Dr. Ken Landau. Thanks for watching. Let's talk about Caplyta, or lumateperone, second-generation antipsychotic. It's the 13th second-generation antipsychotic available. It was approved in December 2019. It was available for marketing in the early part of 2020. Received fast-track designation from the FDA. It's an oral medicine. It's taken daily. There's no need to titrate the dose. It's approved for treatment of schizophrenia. It's in phase 3 studies for bipolar disorder, for behavioral disturbances associated with Alzheimer's disease, phase 2 trials for depressive disorder. That's where most of the money is, so that's where the drug ultimately will be used, at least the company hopes. Intracellular therapeutics say that they were built on the Nobel Prize-winning science, but the company has no direct connection with the Nobel Prize. Nobody working for the company has any obvious connection to the prize. Seems like a catchphrase used to give credence to a relatively new company. Actually, the drug appears to be licensed from Bristol Myers Squibb. It's called a butyraphanone type of an antipsychotic. Routinely, we use the second-generation antipsychotics for treatment of schizophrenia, even though controlled studies, they generally fail to demonstrate any clear advantages compared to the first-generation drugs. Well, the second generation are said to have fewer side effects. They don't have as much risk of the extrapyramidal symptoms or tardive dyskinesia, but they have an increased risk of metabolic problems and other kind of adverse reactions. It seems that people who have schizophrenia who don't respond to one of the antipsychotics may respond to another. And now we have long-term injectable formulations to improve the adherence of the patient to the drug. But unfortunately, they're much more expensive options, and they don't work any better. They just are taken once a month or thereabout rather than every single day. Well, the dose is 42 milligrams with food. Label on all first and second generation antipsychotics by the Food and Drug Administration is in the form of a black box. It tells about the increased risk of death in elderly people who have dementia-related psychoses. So it's obviously not approved for this group of individuals. It's metabolized by a series of different enzymes. So you have to avoid the use of valproic acid. It would increase the concentration in the bloodstream of Caplyta. Also, you have to be a little careful of drugs that would inhibit the metabolizing enzyme known as 3A4. So you have to avoid taking Cipro or grapefruit juice or itraconazole or certain HIV medicines. They would all increase the concentration of Caplyta. On the other hand, if the medicine induces the enzyme, it would decrease the concentration of Caplyta in the system. So that would be Tegretol and Dilantin and rifampin and St. John's wort and prednisone and modafinil. Side effects, well, somnolence or sedation occurs in about a quarter of the people who take the drug, frequently dry mouth, headache, nausea, vomiting, dizziness. It can increase the CPK, increase the liver function, can cause some extrapyramidal symptoms, but they don't seem to be any different than in the placebo group, but it could cause some tardive dyskinesia, cause some metabolic side effects with the weight gain or diabetes. It can decrease the white blood cells, specifically the neutrophils. Those are the cells that fight bacterial infections. If you take the drug, might lead to orthostatic hypotension. In other words, you stand up, the blood pressure falls, and then you fall, typically after about 4 to 6 weeks. Seizures can occur in patients, especially if they have a history of seizures or they're taking drugs that lower the threshold for development of seizures. It can prolong the QT interval, relatively modest. The QT interval is important because it leads to the potential for arrhythmias. It can lead to a change in body temperature regulation. So people who take the drug can't seem to get rid of the heat, the core body temperature. So if you take the drug and you have strenuous exercise, you're exposed to extreme heat or dehydration, or you're taking an anticholinergic therapy, you might end up with significant problem. Other side effects, or it can cause dysphagia, dysmotility of the esophagus, potentially lead to aspiration pneumonia. It can cause some dystonia. Those are prolonged contractions of muscle groups in susceptible individuals. So you stick your tongue out, or you have a spasm of the neck muscles, you have difficulty swallowing, difficulty breathing, especially risk in males who are relatively young. But it's at any dose in both sexes. You could get the extrapyramidal symptoms. And animals, an interesting thing has developed where they have increase in the systemic intracytoplasmic accumulation of pigmented material. That's taken at a normal dose. So normal dose, the animals tend to develop some pigmented material inside the cytoplasm of the cell. That's in dogs and rats and mice. You see it in the brain, in the spinal cord, in the heart, in the eyes. Can lead to inflammation and neuronal degeneration and necrosis. Can lead to axonal degeneration, still present about a month or 2 months after discontinuing the drug. Now, it's likely that the composition of the material is some polymers or some protein adducts that are formed from the aniline metabolism of Caplyta, but we don't seem to have any aniline derivatives in humans, at least at quantifiable limits, so that doesn't seem to be a problem so far. Other kind of warnings, precautions with the drug, well, it can lead to cerebrovascular adverse effects in elderly individuals who have dementia-related psychoses. So in other words, this is the stroke or the transient ischemic attack that occur about 60% more often than with placebo. We can have deaths from heart failure, sudden cardiac death, infections like pneumonia. People can also develop what's known as the neuroleptic malignant syndrome. Temperature goes up, muscles become rigid, get delirium, autonomic nervous system instability, can get tardive dyskinesia. So if you get tardive dyskinesia, the abnormal movements of the lips or the tongue or around the face, the eyes, or even the fingers or the toes, well, you should discontinue the medicine if it's clinically appropriate. Unfortunately, the tardive dyskinesia may or may not resolve when you stop the medicine. Possibly can be irreversible. And the drug can maybe, in some people, hide the side effects. So you only use the drug if you're not helped with less potentially harmful medication. Develops most in people who are taking a relatively high dose, relatively long period of time. But again, it can come on at any dose, even a low dose, even after a short course, but it's especially common in elderly women. We have to worry about metabolic changes. So the blood sugar can go up, the lipids can go up, the body weight can go up. Sometimes people become diabetic. It's estimated that about 5% of patients, the glycosylated hemoglobin, or the HbA1c, goes from less than 6.5 to more than 6.5. You have to check the weight, both at baseline and frequently afterward. Find about 7% of the people increase their body weight, have to worry about those white blood cells that we talked about. You can develop a low level of granulocytes or neutrophils. So you want to get a blood count before you start taking the drug, especially if you have any pre-existing history of a low white blood count. Stop if the white blood count, the polymorphonuclear leukocytes, simply called the neutrophils, less than 1,000. Well, you monitor the heart rate, the blood pressure. Warn patients, especially if they have cardiovascular, cerebrovascular disease, especially elderly, especially dehydrated, especially people who are low in body fluids, hypovolemic, not drinking enough liquid. People who are taking certain of the anti-HIV medicines. And Caplyta is not evaluated in patients who have suffered a recent myocardial infarction or have unstable coronary vascular disease. Well, there also is the potential for cognitive and motor impairment. That leads to altered judgment, thinking, and motor skills. May lead to potential problems operating machinery. Can lead to falls, and falls can lead to fracture. People who take the drug can have some motor or sensory instability. We talked about the somnolence, postural hypotension. The way the medicine works, standard kind of way, works on the serotonin, works on the dopamine, doesn't seem to work on the histamine, doesn't seem to work on the noradrenaline or the muscarinic receptors. But the actual mechanism, that's just postulated. We don't really know how these kind of medicines work. Seem to be more effective in treating the positive symptoms of schizophrenia. So people who have hallucinations and delusions, and it's less effective in treating people who have the negative symptoms, people who have apathy, people who have social withdrawal, or people who have a blunted affect. Animal models, it's not carcinogenic, it's not mutagenic, but it can impair fertility. It can decrease the sperm motility in men and decrease the corpus luteum function in women. Corpus luteum function, that's important because that's what makes the progesterone. Can cause problems with pregnancy, obviously not to be used in pregnancy. Withdrawal symptoms in the baby may occur in those women who do take the drug. Have to realize that people who are pregnant who have schizophrenia are at increased risk of significant medical problems. So they need some kind of therapy, but if you take the drugs, have an increased incidence of hospitalization perhaps, or suicide. Pregnancy and lactation drugs not studied, but it does, at least in animals, cause visceral and skeletal changes, decreased weight, and it also increases the likelihood of postnatal death. Lactation, we don't have any data in humans whether the medicine's present in milk, or even whether it decreases the concentration of milk, decreases the production of milk. No evidence for use in the pediatric population. Geriatric population hasn't been studied in people over age 65. Bioavailability is very low. It's only about 4.5%. Steady state's reached after you take the medicine for about 5 days. If you increase the dose, you increase the blood level, but there's a lot of variation in between individuals. Seems the maximum concentration of the medicine, if you take it in a fasted condition, is about 1 hour, 2 hours if you take it in a fed condition, so with food. Now, a high-fat meal is going to decrease the maximum concentration by about 33%, but over the period of time that the drug's in the system, it's going to be a wash because it'll increase the area under the curve, so you get the same effect whether you take it with food or without food. Half-life is kind of long. Intravenously, it's about 18 hours. Protein binding is close to 100%. It's eliminated about 60% in the urine, about 30% in the feces, metabolized to more than 20 different metabolites. Well, if you have liver disease, if it's severe, shouldn't take the drug. If it's mild, well, you can take the drug with no change in the dose. Again, if you have renal disease, mild to moderate, you don't have to change the dose. But if you have severe renal disease, it's going to lead to an increase in concentration of the drug. Well, the FDA approved this medicine on the basis of 2 4-week double-blind randomized studies. One had 84 patients. Dose was 42 milligrams. The other had 150 patients. Again, dose 42 milligrams. So there was a statistically significant decrease in the symptoms at 42 milligrams, but not at 28 milligrams and not at 84 milligrams. And unfortunately, this is one of the drugs that was tested in multiple sites, 33 different sites, one study. 75% of the people were men, 75% of the people were black. The ages, 18 to 40, about half the patients, 40 to 60, about half the patients. But there was a question about the symptoms and whether the patients were otherwise controlled before they entered the study on their regular medicines, and then acute discontinuation of their antipsychotic medicines made them get worse, which would make the medicine look better, obviously, if it were started with the Caplyta. So there's a little bit of question about how great the medicine is. Well, if you suddenly discontinue the medicine, you're going to have the potential for worsening of the psychiatric symptoms. And that's what might have happened in some of these patients. They develop anxiety or depression or agitation, mood swings, headache and insomnia. Maybe they develop worsening extrapyramidal symptoms, dull-looking face, not moving too quickly. Well, the studies looked at what's called the PANSS. That's positive and negative symptoms of schizophrenia. And they did the study, they did the questionnaire after the patients were taken off of their standard therapy. So that caused a little bit of a problem in interpreting the results and deciding whether the medicines really all that good or not. So when the patients were evaluated for the therapy, they were inpatients for about a month while the study was ongoing. If the person had major depressive disorder, person had bipolar disorder with psychotic features, they weren't allowed in the study. Substance abuse within 6 months. If they had taken an injection for antipsychotic behavior, they couldn't be suicidal. They had to be able to be safely discontinued from the antipsychotic medicine and the mood stabilizers and lithium and the antidepressants. So as a result of all of this, I'm not exactly sure where the drug fits in overall. One trial actually included some comparison to patients taking Risperdal. And even though they weren't included in the final analysis, the patients on Risperdal seemed to do better than the patients on Caplyta by a smidgen. Well, if we look at the response to the PANSS, remember the positive and negative symptoms of schizophrenia, it seems that the improvement was very modest at best. It was reduced by about 13 points on a scale that ranged anywhere from 30 points to 210 points. So not included in the FDA material was what would happen if you were taking a 28 milligram dose. What would happen to the PANSS? You were down about 19 points, 42 milligrams, you were down about 17 points. Well, if you were taking the 42 milligrams, you were down about 13 points. So to some people, that doesn't sound all that impressive. Actually, in JAMA, the Journal of the American Medical Association, in January, or in 2020, they said that Caplyta doesn't offer any unique efficacy, and it doesn't have any change in the negative symptoms. Well, they did some studies, or are doing some studies on an ongoing basis, of bipolar disorder. So as sole therapy or in addition to lithium and valproate. But the majority of the patients were in Russia and Colombia, more than 50 sites. They improved, but they improved only modestly, so minimal benefit. Doesn't seem to be a home run. There was a paper in the American Journal of Psychiatry, had 10 authors. 6 of them worked directly for the company, and the corresponding author was at Intracellular Therapeutics. So the company sponsored the trial. The company had people on doing the trial. We have to be a little bit cautious about whether we consider the drug really all that good. So if we look at the positive symptoms of schizophrenia, the delusions and the hallucinations, seems to work better than on the negative subscale. Negative subscale basically is the same as placebo. Neither of them work very well. Medical Letter, that's a respected publication in medicine that doesn't take any advertising. Well, they say that there was modest improvement in 2 of 3 short-term clinical trials, but it's unknown whether any advantages accrue to Caplyta versus any other second-generation drug. So what the recommendation is, until long-term data or the results of head-to-head trials where it's compared to other drugs like the Risperdal that we talked about a moment ago, the Medical Letter concludes there's no good reason to use the drug. And the cost of the drug, well, if you take the 42 milligram dose and you get 30 of them, so a month worth, and you pay cash, it's about $1,600. If you use a coupon that the company has on GoodRx, or rather is on GoodRx, it's about $1,300. That was when it was first brought out to market. Now it's up to $1,460. Copay, well, the company has a copay card, so no charge for the first fill of the drug and $15 for each monthly refill. So you pay $15 and the insurance company has a negotiated rate of a considerable amount of money. So you say it only costs $15? The total amount of money changing hands is significant. On the other hand, you could go out and pay cash for Abilify or Seroquel or Risperdal for no more than $10 a month. On the other hand, if you get some of the new drugs like Vraylar or Rexulti, you hear advertised on the television all the time, that's $1,200 a month. So the bottom line is, should you consider Caplyta? I'm not sure that this new medicine has any demonstrated superiority over the older medicines, but at a cost of about $1,600 a month, discounted to whatever the drug company is going to say. With the copay card, you pay nothing. Well, unfortunately, that's what drives the rates of insurance sky high. In other words, they sock it to the insurance company, and they'll happily erase whatever your copayment is. But the total cost for the Abilify and the Risperdal and the Zyprexa and other second-generation antipsychotics is between $4 and maybe up to $20 or $30 a month. No good evidence that Caplyta offers anything in excess of that. And don't forget, many patients who are taking the medicines are taking them for off-label indications. So people take them for sleep. These drugs, as we talked about, have a lot of side effects, so they shouldn't be taken unless other medicines don't work, and then they should be used only for the approved indications. Shouldn't be used for off-label indications where other kind of therapies have a good chance of working. Anyway, thanks for watching. If you enjoyed the show, please tell a friend. Consider subscribing so you'll be notified as we post new videos. I appreciate your interest. I'm Dr. Ken Landau.